This is the first center in Germany and the largest center in Europe to treat patients with cancers with proton beams, proton scanning method. Proton beams, that's an advanced form of cancer radiation, which is good for any sort of cancer, which up to now you could treat with X-rays. X-rays and protons are not like a pill you take against your headache. These radiations are both so-called ionizing radiations, which in effect damage the genetic material of all cells. They damage as well cancer cells as healthy cells of surrounding healthy tissues. With X-rays, you always have a problem. X-rays can be targeted in 2 dimensions, up, down, left, right. But they cannot be targeted in the 3rd dimension, in the direction of the radiation, meaning it's a sort of shoot-through method. Imagine this to be the skin, and you radiate with your X-ray from here, and then the doses of the X-rays is deeply going down in the depth of the body. This simply because X-rays, as light, they are sort of energetic light, are absorbed in the tissue. And now imagine a tumor being here, somewhere in the depths of the body. The doses the healthy tissue will receive under the skin is much higher than the doses the tumor gets. And the X-rays will go farther and even leave the body on the other side. The result of this is quite simple. If you try to radiate a tumor with X-rays, about 3 to 5 times as much radiation is hitting healthy tissue. And this means that you get a lot of side effects. And the side effects are very, very bad. Either you have a high doses and you will sterilize the cell, the tumor cells, that's fine. If you apply in the surroundings a lower doses, you will get a lot of radiation scares. You will even introduce later on so-called secondary carcinoma, which is very important in children with a long lifespan. When you use radiation, you always provoke the healthy tissue and you will generate cancers later on. And that's very, very important with children who, when they have gotten a successful cancer treatment of the original cancer, they have a long life expectancy, and after 10 years or so, they can develop cancer with X-rays about 3 times more often than with proton in an area which had been irradiated but were outside of the original cancer in an area which had originally been healthy. But the radiation has initiated a secondary carcinoma. It's different with protons. Protons do have exactly the same effect within the cell. Again, tumor cell or healthy cell. However, outside of the cell, the distribution of the doses is totally different. We concentrate the radiation within the tumor. And this gives the therapist a huge advantage. He can select the sterilization dose for the tumor without fear of doing too much damage in the surroundings.
We are treating here every tumor which is coming for treatment. This means we have no selection of tumors here. This especially concerns brain tumors, this concerns tumors in the lung, this concerns head and neck tumors. This is most important with head and neck tumors because the salivary glands were mostly destroyed by conventional radiotherapy. The patients got a dry mouth, and for eating every day they had to drink a lot of water or mixed food. With protons, the side effects are reduced to minimum and the patients can eat normally during treatment. They have a normal food intake, they have no weight loss, and after the treatment they go home immediately. They need no rehabilitation at home. And their vitality is not at all influenced by the proton therapy. The biggest advantage of proton therapy is the targeting. We are aiming to the tumor itself. We can save functional organs from radiation. By this, the radiation to the normal tissue is reduced by 60% in comparison to conventional radiotherapy. As the new technology of protons with the scanning technology, we are treating in the range of millimeters. And for this, it is rather important that the patient is lying in a precise position, and therefore he gets a blue bag. This is a mold which he gets every day for the treatment. Therein he can't move, and the tumor will stay always in the same position, and we can treat the tumor precisely without treating functional organs around the tumor itself. So by this, the healthy tissue is saved as much as ever possible. The gantry is moving around the patient, and the beam is always aimed to the tumor itself. Therefore, we have the high precision in every area, and if there is something in the way, like functional organs in the body, we can save these organs and treat further on in the tumor afterwards. The gantry has a weight of 150 tons, and this is moved within 1 minute for 360 degrees. This is most important to aim the tumor from every position from outside. And this makes clear we have the highly possible precision. If you are thinking it takes a lot of time, no, it doesn't. One session of treatment is about 1 to 2 minutes only. Proton therapy is the treatment of tomorrow. At the moment, we have only few facilities worldwide, so that the majority of patients can't be treated by protons. But in future, conventional radiotherapy will be replaced by protons, because it is so advantageous for the patient himself, for his family, and for the management of his further life. Proton therapy is essential for mankind, especially for patients having cancer. They have less side effects, their vitality is not at all influenced, and after the treatment they can go home and go back to their job without having rehabilitation.
We have a very high fluency here, meaning we deliver a lot of protons, so we come to this very short treatment times. You do not want to treat it in 10 seconds out of safety reasons, so we are very happy with the intensity of the beam. We are very happy with the range of the beam depending on the velocity of the protons. We are coming up to 38 centimeters into the body's tissue, which is more than sufficient to irradiate the tumor from whatever direction you want. This is a very quick therapy with such a short time per seating per day with this electronic system we have here, which is very advanced in itself and very precise and very reliable.